A lot of people actually ask me about implant versus bridges, and maybe 90% of the times, um, the best option, 90% of the cases, the best option is to go with implants for a lot of reasons. Some of the benefits of the implants is like when you have virgin teeth, which means like intact teeth, you don't have any fillings or crowns on them on both sides of the space, you don't have to damage these teeth and you just have to put implants right in between them. While in bridge, you have to actually damage these two teeth and involve them in the bridge. Other benefits of implant is the ease of cleaning. You can just floss and clean around them just like a normal tooth. They will look perfect like a normal tooth and they will function just like a normal tooth. Some other benefits of implants, um, the confidence that you will have that you're not gonna break a bridge or you're not gonna break a piece of your tooth in there, because every single tooth in there, it's separate by itself. So in case of damage of one of these teeth, we can just treat one by itself. You don't have to go and treat the whole entire bridge. The list goes on with the benefit of implants. Maybe some of the disadvantage of implants, or maybe the only disadvantage of implant, which we're trying to take really good care of it here in my office, is the cost. And it's just a little bit more costly than with bridges option. The biggest benefit of implants is like the implant itself with the crown that will look and feel just like a normal tooth. Versus bridge that won't look and feel like a normal tooth. It add up a lot to the confidence, especially when you have like an anterior implant or anterior bridge. You can spot that easily when you have somebody with a bridge in the anterior area. While an implant, with the new technology that we have these days, that we can just place an implant in the anterior area that just look perfectly, like 99%, just like a normal tooth. It adds up a lot, makes people very comfortable, laughing, no more like hiding their smiles with their hands, and it's just the strength and durability of the tooth, the implant itself. The benefit of bridges, the main benefit of bridges, that 10% of the cases that we cannot place implants on, we usually go with bridges. It's still a good option. It's not like a bad option. It's just like to keep space in there. Bridge is an okay option, but the implant is still the best option in 90% of the cases. And these 10% that when we cannot place an implant, either for a systemic disease or a problem with the bone, that bone is distracted too much that we don't have enough bone to place implant, we go with bridges. Or when we have like damaged teeth on both sides of the bridges, that we can just place a bridge in there, and that will probably lower the cost on the patients a little bit. We always put these two options. We offer the implants and we offer the bridge when we can. But when we can't do an implant, we just go with the bridge option. In some cases, when we have an emergency of like people like losing a tooth in the front and we need something like right away, maybe a bridge is the fastest option. But with the new improved technology and implant, actually we can place implants these days and put a immediate temporizing on the implant. So we can just put a crown on the implant that is not 100% functional, but it will just look perfect like a normal tooth. So this is a new advance in the high tech of implants. So the bridges are not that superior in this field anymore, that they're faster. Implants actually are getting there. Other maybe a slight benefits of bridges, they're a little bit cheaper. But when you have to take in mind the maintenance of the bridge and cleaning underneath it, which is not fun, and it takes a lot of training. You just weigh your options, and I think going with implant is the best option for a lot of cases. So to go over the process of implant, it's pretty easy, but a lot of people, they don't understand what the implant is. So when we have an empty space here in this model here, it's in the anterior area. An implant, it's something similar to screw. We place it inside the bone. It just looks like this. And what happens after that, the body take care of the rest of the job after we place it. In the process, we call it osseointegration. The body accept the implant, and the bone just integrate around the implants. What we have to do after that, we place a post on top of it, which we call it abutment, and that's what will stick out of the implant, and it will look just like a little metal wedge coming out of the implant. And on top of that, after that, we bring the final crown, which will look just like a human tooth, and we just place it on top of all of that, and it will just look normal. Don't look at this empty space here, just look at this tooth. In other models, we can just place implants here and there, and that will just look perfect. Another example here just shows you like another two implants in there, just to place a bridge on top of them. Okay, so some cases we don't have to place an implant for every single tooth. We can cover 3 teeth with 2 implants, and that's similar to the concept of a bridge, but with implant, a bridge. So the average cost of an implant usually here in San Diego area, I would say probably around $3,000. It might goes higher, might go lower, depending on the complications of the case. It's probably very comparable to the cost of a bridge. If you walk into a dental office that you don't have any insurance, it's probably gonna be almost the same cost. Maybe the implants will be a little bit more expensive. Insurances these days, they're being aware more and more to cover more implants. Now maybe 50% of the insurances, they cover implant, while there maybe about 90% of the insurances, they cover bridges. I'm Dr. Bashar Ahmedo. I work at Brite Smile Dental. The address is 6280 Jackson Drive, suite number 2. It's still in San Diego, but it's right on the border of San Diego and La Mesa. Zip code is 92119. And our phone number here is 619-667-3330.